Welcome to the Perfect Dose podcast. We dive into everything you need to know about skincare treatments, wellness tips, and skincare routines so you can look and feel your best. If this sounds like you, make sure you hit subscribe so you can stay up to date on the latest episodes. I'm your host, Dr. Kristen Herzog, board-certified nurse practitioner and injection specialist. My med spa, The Perfect Dose, is located in Scottsdale, Arizona. If you are interested in becoming a patient and seeing me in practice, make sure you head straight to my website. If you're a medical provider and you want to stay up to date on the latest trends, techniques, have access to my protocols, articles, and business tips, make sure you follow me on Patreon at The Perfect Dose. For everyone else, follow me on Instagram and TikTok at The Perfect Dose. Hi everyone, welcome back to this week's episode. I am so excited. I've been getting a lot of requests on Instagram and TikTok to do a full episode about how I got pregnant with PCOS and also about what I am doing different this pregnancy versus my first pregnancy. For those of you who are just joining, I am officially 9 weeks pregnant with my second baby. So super exciting. I have a history of PCOS. So doctors told me it was going to be impossible to get pregnant without IVF. And I did a complete 180 of my lifestyle choices. I started taking supplements. I changed my diet. I changed my workout routine. I changed everything. I got pregnant within 6 to 7 months the first round just by doing that. And then this time, having taken those exact habits, but really amplified them and turning them into my full lifestyle, I got pregnant my first time trying. So super exciting. And I just want to share with you guys exactly what I did, what my diet plan was, what steps I took to change everything, how I went completely non-toxic. Then I'm going to talk a little bit about skincare with pregnancy because there are a lot of myths out there with pregnancy and skincare, what products you can use, what products you can't use. People think you can't use anything active on your skin, and that is just not the case. You can. It's all about using the right ingredients with the right amount of actives. So there's a certain amount of actives that you have to stay within that is considered pregnancy safe, but you can have beautiful skin while you are pregnant. And I will also talk about some pregnancy safe treatment options for you. There are not many, you guys. Unfortunately, you really have to wait to do everything until after pregnancy. But there are a few things that you can do that will help you maintain beautiful skin, help you feel tight and glowing throughout your entire pregnancy. So let's get into it. Okay, so let's talk about PCOS. PCOS, for those of you who don't know, is Polycystic Ovarian Syndrome. I was diagnosed with PCOS when I was, I think I was 18 when I first got diagnosed. I got diagnosed because I was getting actually like hairs on my chin. I started to have hormonal acne breakouts. I had some weight gain, and I also had really heavy, irregular periods. Like, I remember I used to have to call in from school. I would stay home from school because my periods were so heavy and so irregular. And guess what the doctor said? They were like, let's put you on birth control. That's going to fix everything, right? So I started birth control when I was 17 years old, and nobody did anything for my PCOS except put me on birth control. No lifestyle changes were recommended to me. Literally nothing except taking a pill every single day. That was the fix. So I started birth control at such an early age, and it wasn't until I was about to get pregnant that I realized birth control was actually just literally slapping a Band-Aid over all of my symptoms, and that taking birth control like I did nonstop for so many years. And you guys, I literally took birth control forever. Since I was 17, I first got pregnant when I was 30 years old. So that's 13 years of birth control. And when I was on birth control, I was not getting a period at all, which my gynecologist said was normal. They're like, it's okay if you don't get a period, as long as you are not trying to have a kid, it doesn't matter, right? So I wreaked havoc on my hormones in my body for years and years and years. And now there's a ton of data out there that shows how harmful birth control actually is for you and that it can decrease fertility long term. There's studies that even show it increases the risk of developing breast cancer, so many things that we just didn't know back then. So fast forward, here I am almost 30 years old. I was 29 at the time when I decided I wanted to get pregnant. So I went to see my primary care doctor, and they're like, well, you have PCOS, polycystic ovarian syndrome, and that's like where you have cysts all over your ovaries. You are not going to get pregnant without IVF. So you should go ahead and consider getting IVF whenever you're ready to get pregnant. Best thing to do. That's what they told me. So here I am, 29 years old. I'm just freshly married. I'm so excited. And I'm like, oh my gosh, okay, I'm going to have to scramble and get IVF. There's no other options. And my husband at the time, he was like super into biohacking because post COVID, he had a lot of issues with his gut and things like that. So he got really into biohacking. And he's like, Kristen, we need to look into some natural options to reverse your PCOS. And this really sparked my interest. I'm like, you know what? Yeah, everybody's telling me IVF, birth control, that's it. And that just stop taking birth control when I'm ready to get pregnant, and don't wait a full year before getting IVF. Come back and see me to consider IVF in 6 months because we already know you have PCOS and you're going to need it. That's what the doctors told me. So I started doing my own investigation and really diving deep into my health and my hormones. And what happens when you have PCOS is your body develops insulin resistance most of the time. And insulin resistance means your body is not able to produce enough insulin to keep up with the sugar intake that you have. So this can eventually lead to prediabetes and diabetes and all these other things. So I learned that I had insulin resistance, and I'm like, okay, well, what can I do to change my insulin resistance? And given at the time, you guys, I'm going to show you a picture. This is me in my early 30s. I was not overweight by any means, like obese or anything like that. I definitely wasn't super healthy. I had been yo-yo dieting all of the time at this point to try to be skinny. I was like running all of the time and just basically not eating, but I wasn't really doing anything specifically for my hormones and my body. And so once I learned all about insulin resistance, I decided to do the keto diet. And this is not something that I recommend doing long term, but I'm telling you guys, it is what really jump started my body to heal from insulin resistance. So I went completely keto. And when I say I went completely keto, I did not do the keto, the dirty keto. I didn't eat like a ton of cheese and sour cream and dairy and all these things that you see on the internet of people doing the keto diet when they're just overloading with any sorts of fats. What I did was I really focused on healthy fats. So making sure that I ate lots of avocado, lots of olive oil and butter, healthy fats. And I wasn't doing a strict keto where I was like peeing on those little strips and making sure my body was in actual ketosis. I was just following a low carb, high fat diet. So breakfast for me would look like 2 eggs with a whole avocado and some turkey bacon. Lunch for me would look like a chicken salad, and I would have some feta cheese on it, some nuts. I would do a lot of like cashews, walnuts, different things like that. And I would do olive oil for my dressing. And then dinner, I would have something similar. I didn't restrict myself from cheese. I just didn't have a ton of it. So dinner would be, for example, like a zucchini zoodle pasta. So I would do zucchini noodles with ground beef, and then I would do Parmesan cheese. I would always cook my meat with butter. So that's what I did. And I did this keto diet for probably 3 to 4 months, and my body completely changed. I lost a ton of weight. I felt like I had so much energy. I was not being restrictive. At first, it felt very restrictive because I was used to eating carbs, right? I was like the person that was drinking caffeine in the morning for breakfast, sometimes skipping breakfast, and then eating whatever I wanted for lunch and dinner. So this was my life, and it was very different adjusting to this high fat, high protein diet. But once I did it for like, I would say about a month, it became very natural for me, and I started feeling really, really good. And I also wasn't eating any bad sugars, and I was not eating any processed foods. I was trying to cook at home. Now, if I went out, I would maintain keto. Like, let's say I went to a Mexican restaurant, I would definitely have fajitas. I would just skip the tortilla. So I wasn't being super restrictive, but this completely changed my body. And I'm telling you guys, it's what helped me get pregnant. I did this immediately. I was off birth control. while I was doing the keto diet, and I also switched my workouts. So initially, like I said, I was running and just doing a bunch of cardio. I always had in my mind that lifting weights was going to make me bulky. It just wasn't really my thing. I was like super into HIIT, spin, and running. And when I was trying to get pregnant, I still was doing HIIT style workouts, but I incorporated 12-3-30. And I don't know if you guys watching were like into this TikTok trend, but I was so into 12-3-30. 12-3-30 is when you go to incline 12, speed 3 for 30 minutes on the treadmill. Her name is Lauren on TikTok. I can't remember her last name, but she was like all over talking about this. So I hopped on the 12-3-30 trend. I started doing that for my cardio instead of focusing on just running. And then I was doing some HIIT classes more frequently. So I was lifting weights while also doing the 12-3-30. So I really changed my workouts from cardio only to bringing in some weightlifting workouts. And the next thing that I did was I started taking Berberine, because with insulin resistance and your body's inability to control blood sugar levels, because you cannot make enough insulin to keep up with the blood sugar levels, I started taking Berberine. And Berberine is a natural supplement. It helps to control your blood sugar levels naturally. It also helps your body to metabolize carbohydrates better. So I started taking Berberine, and this is something that I learned. So metformin, for those of you who don't know, metformin is a drug that they put you on for diabetes. And it basically is doing what Berberine does, but on a way higher level, because it's an actual pharmaceutical medication. And metformin actually increases your chances of getting pregnant. So sometimes they'll put people on metformin in order to increase their chance of getting pregnant. So Berberine actually helps increase fertility. So I was taking Berberine like no one's business. I was doing the max dose daily every single day, maintaining that keto diet. Like I said, I did that for like 3 months. And then 3 months after I was strictly keto, I started incorporating a little bit more carbohydrates in my diet, and I would eat like sweet potato or sourdough bread or rice. I tried to make it healthy, and what I learned was that I needed to pair my carbohydrates with a fat, and if I did that, my blood sugar levels would maintain. So I didn't necessarily have to be keto forever. I just needed to maintain my blood sugar levels, and I did that, you guys, and I got pregnant. And my doctor was totally shocked. She's like, "Oh my gosh, I can't believe you got pregnant." She redid my labs, and my labs showed that I no longer had PCOS. Now, PCOS is not curable. You will always have it. It's literally, you could get an ultrasound, and I'm sure there are still cysts on my ovaries, but the levels in my blood that she measured initially to the point where she redid my labs when I got pregnant were completely different. I had reversed my insulin resistance. I dropped my A1C level, and that is a level where we monitor your blood sugar, how high it is over time. So my levels had significantly decreased, and I had reversed my insulin resistance naturally with diet, with exercise, and with understanding that I had a hormone irregularity in my body, and that I didn't necessarily just need to rely on Big Pharma and IVF and medication in order to fix that. I had to fix from the inside first, and that was a complete healing process, and it took me 6 months, and then I got pregnant. And so I wanted to share that with you guys, because I think that we are so quick to take a pill. We are so quick to just take a quick fix. Like, oh, my thyroid's imbalanced. Let me take a little thyroid medication and that's it. Versus really diving deep into why your thyroid is imbalanced, what is going on at the cellular level, and then making that commitment and change to completely reverse that. You can heal so many things through diet and exercise, and we are learning this as we go. So that's what I did to initially get pregnant, with just reversing my lifestyle and my diet. Now, fast forward, I was pregnant, and during my pregnancy, I did have a little bit of a tougher pregnancy. I had a lot of anxiety throughout my pregnancy. After delivery, I did have postpartum depression, and I wouldn't say that it was like I was super sad and depressed and crying, or I never had those feelings of wanting to kill my baby or anything like that. I had severe anxiety. Like, I would picture the worst thing happening to Jax. Like, I remember it was so scary for me to even walk down the stairs with him because I was panicking that I was going to drop him and he was going to die. And I would like picture that in my mind, and it would paralyze me and make me feel like I couldn't walk down the stairs with him. I was constantly worried that something was going to happen. I was always feeling like not myself. I am a very energetic person. I feed off of other people's energies. I love talking to people. I love sharing my life, hence why I do this podcast, why I do Instagram and all of these things. And I felt like I was a shell of myself. I was quiet. I wasn't sociable. I was having a hard time even posting on my stories, and I just wasn't feeling like me. So I went to the doctor, and of course I was met again with, here's a pill, right? Oh, you have postpartum depression. Let me go ahead and prescribe you an antidepressant. You'll be good to go. And I'm thinking, this feels so different than depression. Like, I'm having so much anxiety that started with pregnancy. It's worse. I don't feel like myself, but I'm not depressed. I feel like there's something else going on. And it was like my intuition that just felt off. Like, this is not what I need. So I didn't go to that doctor. I instead went to my first ever holistic doctor appointment, and we did my labs. And guess what? My thyroid was off, which happens sometimes after pregnancy. I was diagnosed at that time with Hashimoto's thyroiditis, and that is when you don't have enough thyroid hormone in your body. So your body starts producing more thyroid hormone. It has this like drive of production. So your TSH levels go up. And your T3, T4, which is how you convert into thyroid hormone, is completely out of whack too. So this doctor's like, well, you have thyroid issue, plus your levels, which are your TPO, these are antibodies in your body, were super high. So that's why it was that autoimmune component of Hashimoto's. And she's like, this is why you're feeling the way you're feeling. You don't need an antidepressant. We need to optimize your thyroid. So she gave me options, and she's like, we can put you on a thyroid medication, or you can try to reverse this on your own. And I'm like, okay, I have done a reversal of my PCOS on my own. And of course, with pregnancy, I did not like follow a diet, you guys. I just ate whatever I wanted. If you've been pregnant before, you know, it's like suddenly everything just really goes out the door. So I didn't do keto during pregnancy. I wasn't really, I mean, I ate healthy, but I just wasn't really watching what I ate. I wasn't as strict. And in postpartum, same thing. I just was doing whatever I could do to survive because I didn't feel good. And so when she said this to me, I'm like, okay, this is my wake up call. I am going to do everything that I can to reverse my thyroid issue without having to take a pill, because I just don't want to take a pill. It's not for me. I will if I need it, but it's not something that I'm going to jump to. I'm going to first try everything I can to do it on my own without a pill. So I asked her for my options, and she put me on selenium. And selenium, zinc, and iodine are supplements that you can take if you are experiencing thyroid issues to help optimize your thyroid and help your thyroid work better. So I started taking those supplements. I did a full anti-inflammatory diet. So I cut out carbs, and not all carbs. I still ate fruit and vegetable, but I cut out grains like bread and pasta, and I started eating super high protein, super lean protein. So I was eating like turkey bacon, eggs. I pretty much was doing a keto diet, but I was focusing more on protein versus fats this time. And I was doing very minimal carbs. So I would do like sourdough bread if I had bread. I definitely wouldn't eat anything white. And I would do sweet potato for my carb. I sometimes would do white potato. Like, I'm a sucker for French fries. So if I went to In-N-Out and got a protein style burger, I would definitely eat the fries. But that's really all I did. And I started noticing my energy levels were improving. I started leaning out. I dropped the postpartum weight super fast doing this. And mentally, I started feeling clear and better. And I also started cold plunging, and there is a lot of data out there about the benefits of cold plunging. And if you follow me on Instagram, you saw me literally getting in my pool in November at 5 a.m. It was freaking freezing cold because I don't have an actual cold plunge device. So I just cold plunged in my pool. And I was reading that doing cold plunge, putting your body through that shock, that cold temperature, can help regulate your thyroid. So I was cold plunging every single day. I never missed a cold plunge. And let me tell you guys, I don't like cold plunging. Nobody freaking likes to get in the cold water, okay? It's horrible, but it feels so great afterwards. I felt like I just drank a Celsius. So I felt so good. I had a ton of energy. So I started doing cold plunging, and I went back, I would say probably like 6 months later, and my thyroid levels had regulated. Everything was good. And that is what I do to this day. Up until right before I got pregnant, I was eating clean. I was eating high protein. I started lifting more weights than I did in my first pregnancy. I started doing mostly strength training with very minimal cardio. So that was a big switch for me. And I continued taking my supplements. I eliminated everything toxic. So this is something that not everyone is talking about, but there is toxins in everything. Like your tampons have plastic in them. And so microplastics are extremely toxic for you. They are hormone disruptors and just terrible for your body. So I went full non-toxic. Like even the toilet paper in my house is non-toxic. We drink out of glass bottles for everything. We do no plastic. So I eliminated toxins from my life. I stopped using candles, which was very hard because I love a good candle, but those are also hormone disruptors. So I just went on a full non-toxic journey, plus implemented those lifestyle changes that I made when I first got pregnant, but amped them up, like focused more on protein, focused more on weightlifting, and really just optimizing how I feel. And yes, I would sometimes like eat some sugar or something like that, but it was rare. It was like a once a week treat. It was not something that I consumed every day. And I just felt amazing. So that is what I did. And I think because of the combination of what I learned from my first pregnancy with getting my body right and doing what my body needed, I was able to do that same thing after pregnancy. And then I got pregnant literally the first time I tried, which was really shocking to me. I was not expecting that, but I was so much healthier when I got pregnant this time than I was the first time. The first time I got pregnant, I had just started my health journey. So yes, I got pregnant within 6, 7 months, and it was a lot of hard work and lifestyle changes. But since I implemented those and really maintained them for, I mean, Jax is 2 years old now, and I started this about 6 months postpartum. So you're talking like a year and a half of dedication to working out every day, strength training, going non-toxic, eating super clean, high protein, all of those things. I really optimized my body, and it was so easy for me to get pregnant this time. So hopefully you guys have some big takeaways from that. If anybody listening is suffering from infertility, I am praying for you. I know that that is such a difficult thing, and I highly encourage you to explore your own body and to see what's going on from within and try to completely change your lifestyle. If you are thinking about getting pregnant, I totally recommend taking these tips and doing them because it is going to make your body healthier, and it will be easier to get pregnant when you implement healthy lifestyle and non-toxic behaviors. Okay, so let's move into skincare with pregnancy because I want to talk about this. A lot of people think you can't do anything for your skin and you're gonna have breakouts and dull skin and all of these things, but that is not the case. The key is that we use the right skincare ingredients that are proven to be safe and effective. So, what do you have to eliminate when you're pregnant? You have to eliminate retinol. Retinol has been shown to cause birth defects. Now, they don't know the exact amounts that can be absorbed into your skin and actually get to the fetus. So there are some data that are saying you can use topical retinoids safely. It's very conflicting. Most people put it as a pregnancy X category, so do not do it at all. I stick to that. I don't do any retinols. For me, I'd rather just be safe than sorry. So no retinols, and we have some alternatives that we can use instead. So Bakuchiol is a plant-based retinoid alternative. It is my go-to. It stimulates collagen, it tightens your skin, and the purpose of a retinoid is to help collagen formation and to also increase your cell turnover. So new fresh baby skin. So Bakuchiol is the ultimate hack. I do this on my face and all over my body. I did it my first pregnancy and I got no stretch marks, you guys. So I can even do a whole skincare episode for you so I can break down everything that I'm doing right now to prevent stretch marks and what I did in my previous pregnancy and include some other skincare tips. So I will do that for you guys. But I did Bakuchiol every single day, all over my face and my body. I use it at night for my face and body. So think of like your nighttime routine as you're repairing. So what do I need to do to repair my skin? So that's what I did. The next thing that I use, and that is pregnancy safe, are AHAs. So salicylic acid is really great for acne. It's like gold standard for killing acne on your skin. And the key is with salicylic acid, we have to use a 2% or less in order to be pregnancy safe. So there are a lot of different products on the market that have 2% or less salicylic acid. You can incorporate these into your skincare routine and be rest assured that it is pregnancy safe. So complexion pads by Zio, I love these. Tonic is by Perfect Dose RX. This is super clean, non-toxic, absolutely amazing. It has a combination of a few other AHAs in it as well, all within pregnancy safe standards. The next treatment that I really love with salicylic acid in it that is pregnancy safe is going to be the acne treatment by Skin Medica. This also has niacinamide in it, and niacinamide is really great for helping with pigment and several other skin conditions. So I highly recommend getting this product if you are prone to acne and you want to treat your acne while you are pregnant. You can incorporate this into your skincare routine. All of it is pregnancy safe. The next acid that I want to talk about is glycolic acid. Glycolic acid is absolutely amazing for exfoliation on your skin, and glycolic acid is safe in the right amounts. So you have to focus on products that are 10% or less glycolic acid in order to be pregnancy safe. So if you are looking at any of your skincare ingredients right now, if you find a glycolic acid with 10% or less, you can continue using that on your skin. So those are the acids that you can use. The next thing that I want to talk about is vitamin C, because vitamin C is a freaking game changer, you guys, and you can use it pregnant, not pregnant. Everybody starting in their 20s should be using this. So vitamin C is a potent antioxidant. It is going to help with collagen formation. It is going to help protect your skin against UV damage. So important to really block those rays. And we know that the sun is one of the number one causes of aging in our skin. So super important that we apply our vitamin C. This is going to be extremely preventative, and it is also going to treat your skin throughout pregnancy. So those are the products that I would not skip. I would grab an AHA, salicylic acid. I love 2% or less. If you're using glycolic acid, just make sure it is 10% or less. A vitamin C serum, hands down, recommend for everyone. You can find a cleanser that is safe just by looking at the ingredients and making sure that those actives are within that range. And I also love a Bakuchiol. If you're going to choose one product after listening to this episode, it's Bakuchiol. And I will actually link a discount code for you guys in the show notes for everybody listening. If you want to buy a Bakuchiol serum, you can save 15% using the code that I link below. Thank you guys for tuning into today's episode. I hope this was super informative. I just wanted to share my personal experience with you guys that I had with getting pregnant, with being diagnosed with PCOS, reversing my insulin resistance, and then getting diagnosed with Hashimoto's and having to reverse that. And again, I still have these things, but I just control them with my diet and my lifestyle. And then hopefully you now understand a little bit more about skincare. You can use products. We can have glowing skin throughout pregnancy. We just have to focus on the right amount of ingredients. And finally, treatments. Before we end this episode, I want to talk about a treatment that I absolutely love during pregnancy, and that is going to be a diamond glow facial with something called Forma on top. And Forma, you guys, is radio frequency with no needles. So during pregnancy, you don't want to do any procedures that will break the skin because that has an increased risk of infection. Antibiotics are not pregnancy safe. So super important that you do the right procedures, but Forma is a freaking game changer. Radio frequency is heat that is forcing your body to stimulate collagen. So it's going to help tighten your skin. It feels like a hot stone massage. It feels freaking amazing. And you can get this throughout pregnancy. Now, results are not going to be the same as a Morpheus. So I need to be clear with that. You're going to be needing to do radio frequency treatments more frequently in order to get the same collagen stimulation that you would with a Morpheus. And that's just because there's no needles driving in that energy. So it's like if you were to do a less invasive procedure, you're just going to need more treatments in order to get the same results. But that is what I recommend. I do it monthly. So I get a Diamond Glow facial plus a Forma add-on every single month, and it is next level. It makes me feel so great. My skin is glowing, and it's something that I can do to help maintain my skin throughout pregnancy. So thank you guys. I will see you next week.